Hello, I am Fahad Quadri Syed. I am going to give the presentation of examining the impact of value-based reimbursement on healthcare providers and analysis of a proposed reform in the US healthcare system. Introduction. Overview of the topic. This presentation examines the impact of value-based reimbursement (VBR) on healthcare provider in the US. The shift from a fee-for-service model to value-based system aims to improve patient outcome while controlling cost. Key areas of focus: healthcare financing and reimbursement, impact on healthcare provider and professionals. What is value-based reimbursement? Value-based reimbursement (VBR) represents a shift from the traditional fee-for-service (FFS) model to one that ties provider compensation to patient outcome and cost efficiency, rather than paying provider per treatment or procedure. The VBR model rewards them for improving overall patient health and achieving specific health-related goals. This incentivizes healthcare professionals to focus on quality care, efficiency, and prevention rather than service volume. How it works: payment is based on patient outcome, satisfaction, and overall value. Importance of VBR in US healthcare system. Problem with fee for service: encourages volume over value, leads to over treatment and unnecessary costs. Goals of VBR: improve healthcare quality, control costs, enhance patient satisfaction. The transition from fee for service to value based model is crucial to addressing rising healthcare costs and inefficiencies. Under the FFS model, healthcare are provider are reimbursement for each service of procedure. Systemic changes addressed by VBR. Context in healthcare system framework. Reimbursement model: VBR shifts payment incentives. Healthcare providers. New model reshape clinical decision and making and care coordination. Systemic impact. Charges in healthcare financing. A shift in the role and responsibilities of healthcare provider. To shift to VBR addresses fundamental issues in the US healthcare. Strength of value-based reimbursement. Improved quality of care. Providers are incentivized to deliver the most efficient treatment and improve patient outcome. Cost reduction. By focusing on preventive care, VBR can lower long-term healthcare costs. By focusing on preventive care, enhance coordination, encourage team-based care and integrated healthcare system. Challenges of value-based reimbursement. Implementation barrier. High initial setup cost. Resistance from provider used to fee-for-service model. Despite its benefits, VBR presentations significant challenges. Healthcare providers accustomed to fee-for-service may resist the change due to administrative complexity, lack of financial incentives, and concerns over risk. The initial implementation costs are high as practices must adapt to new reporting the performance tracking systems. Comparison to previous models. The fee-for-service (FFS) model traditionally rewards healthcare providers based on the volume of services they delivered, often leading to overtreatment and unnecessary procedures. In contrast, the value-based model emphasizes patient outcome, aiming to reduce inefficiencies and improve overall health. From a social justice perspective, VBR aligns more with the goal of universal access to quality care, addressing disparities often created by market-driven healthcare systems like FFS. Economic principles in VBR. VBR interests with economic principles such as supply and demand, moral hazards, and market failure. By emphasizing patient outcome rather than volume, It reduces moral hazard, where provider may be incentivized to overtreat. The system also aims to correct market failures by focusing on preventive care, potentially lowering long-term healthcare costs with supply and demand. Providers can better align their services to patient need without overloading the system. Informational interview insights. Dr. Emily Chen, CFO, Urban General Hospital. VBR encourages investment in preventive care and long-term health strategies, but transitionally is costly. Dr. James Albright, primary care physician. Patient care quality improves when providers are incentivized to focus on outcome rather than service volume. Sara Patel, policy analyst, CMS. VBR could revolutionize the system, but it requires overcoming significant administrative hurdles. Implementation challenges. Provider resistance. Many healthcare providers are accustomed to fee for service and may resist change. Administrative complexity. Shifting to VBR requires changes in billing, reporting, and care coordination structures. Evaluation of VBR effectiveness. The effectiveness of VBR can be assessed through measurable outcomes such as reduction in hospital readmissions, improved management of chronic diseases, and overall cost savings. Data shows that VBR improves care coordination as providers are incentivized to work together. Moreover, outcomes such as patient satisfaction and preventive care are key performance indicators in determining its success. Long-term studies suggest VBR may help in controlling healthcare costs. Personal stance on VBR. I favor value-based reimbursement as it promotes a shift towards sustainable care delivery and improved patient health care. VBR emphasis on quality over quantity aligns well with the evolving need of the US healthcare system, where rising costs and inefficiencies have become major concerns while implementation presents challenges. Its long-term benefits in terms of cost control and patient outcome makes it necessary reform. Conclusion. In conclusion, value-based reimbursement represents a paradigm shift that seeks to improve healthcare outcomes and reduce cost. While it presents challenges such as a provider resistance and administrative complexity, its potential to create a more efficient, effective, and equitable healthcare system outweighs the risk. The key to success lies in overcoming implementation challenges and ensuring board support from all stakeholders in the healthcare system. Thank you.